Put it on Facebook. Alrighty. Let's see. Preparing live stream. Let's see if it'll pop up. All right. Go live. All right. So I don't see David, you there?
Yeah, I'm right here, bro.
All right. So it's just the three of us so far.
Yep.
All right. Let me go see where the other guest is. And regardless if they come on, we're gonna just kick it off. All right, fellas?
That sounds good.
I don't like wasting nobody's time. Let me see if I can find him. Let me message him. I had brother Terry, Tracy was all wound up today, boy, in my barber chair.
Why?
Which means he was he all excited about this topic.
Okay.
I found a video, Trace, right? I found a video about this one doctor, and he had everybody's patients get the vaccine, but the reason why he didn't get the vaccine is because, like with any other type of virus or whatever, because they're giving you a piece of the virus, right, inside the maybe a dead strain, I guess, but it builds up antibodies so that you won't, if you get it, it won't be as harsh, right? He says that the reason why he didn't get it is because he had it before COVID or whatever the case, and he kept getting some kind of finger test. I guess you would know what that is, like a finger test or something like that. And it showed that he had high antibodies against that strand. So he says no need for him to take the test. That was his thing. I can play it. It's like a 2-minute thing, but that's the gist of it.
No, it's yeah. I mean that's definitely touched on some topics that we talked about today. He just didn't not get the vaccine without checking to see if he had an antibody.
Right,
You see what I'm saying? So I'm pretty sure he probably did like an antibody titer just to see if his body was producing it. And once he got that confirmation, it probably confirmed his decision not to take it.
Right.
I mean that makes sense. I wouldn't recommend it, but I see his thought process.
Right. All right. Let's should we give him about 3 more minutes? It's 4:04. What you say?
Yeah, sure.
All right. We'll give him a few more minutes. And yeah, we'll do that. So I think the way we're going to play this out is, of course, we're going to do our little podcast thing. We'll keep it light. If you're the only guest on today, we're going to introduce you and just let you roll, bro. Just let you do your thing. You know what I mean? So you can be Dr. Tracy, or you can be Tracy today. Which one you gonna be, man?
However it come, I'll adjust accordingly.
Oh, I don't know about that. That's kind of dangerous, ain't it? You're a dangerous man.
This is a dangerous topic.
Cool. All right, let's see here. All right. I think what you call it is in the shadows. We got Cassandra, Miss Davis is in now. We have who else is coming on? Kareem, he's on. Your homie, he's there.
Shout out.
Yeah, got 2 doctors in the building. I'm still waiting for the
almost. You got a couple of years left.
Yep. So in a few minutes, Dave, you can go ahead and kick off.
All right.
Your spiel and go from there. But how's everybody doing? Miss Cassandra, Miss Davis, Kareem?
Hi, everybody. I'm doing well. Hello, everyone.
Hey.
How you doing?
How you doing? You're not gonna let us see your pretty face, huh?
You're not gonna let us see your pretty face, huh? You're not gonna let us see your pretty face, huh? You're not gonna let us see your pretty face, huh? You're not gonna let us see your pretty face, huh? You're not gonna let us see your pretty face, huh? You're not gonna let us see your pretty face, huh? You're not gonna let us see your pretty face, huh? You're not gonna let us see your pretty face, huh? You're not gonna let us see your pretty face, huh? You're not gonna let us see your pretty face, huh? You're not gonna let us see your pretty face, huh? You're not gonna let us see your pretty face, huh? You're not gonna let us see your pretty face, huh? You're not gonna let us see your pretty face, huh? You're not gonna let us see your pretty face, huh? You're not gonna let us see your pretty face, huh? You're not gonna let us see your pretty face, huh? You're not gonna let us see your pretty face, huh? You're not gonna let us see your pretty face, huh? You're not gonna let us see your pretty face, huh? You're not gonna let us see your pretty face
Oh, I don't look so pretty today, Will. But thank you.
Yeah. Just put a face with the voice. That's all. That's all.
Yeah, I'm sorry. Nice
It's
to see
okay.
everybody, though.
Yep. Miss Davis, are you there?
I am here. How are you?
Awesome. I'm glad you made it.
Yeah. Finally had some downtime, so I thought I'd hop on and see what you got for us.
All right. Well, it won't be long, but we supposed to have two visitors, but we have one distinguished doctor. Well, two doctors here now, but we have one speaker today, Dr. Terry, and he's going to give it to us. I don't know if he's going to be a doctor or Terry today. We're going to find out. We're going to find out. And but yeah, thank you. We'll get started in a few minutes.
Okay.
Dr. Kareem, what's up? Mr. Surgeon, you there? He probably just clicked on. He says a bit loud where he is. Yeah. I got you.
He a med student, man. He not a doctor yet. He almost there though.
Oh, okay. All right, med student. I heard that twice, so I'm gonna go back to that.
You gotta,
see what it is, right?
Yeah, you don't want to skip the process.
All right. So this is how it's gonna go down. My business partner David's going to jump on in a few minutes, and he's going to describe what Uepik is doing and why we're doing what we're doing. And if Mr. Gibb doesn't come on, he's a doctor up here, a celebrity barber. If he doesn't come on, we're going straight to you. All right. So I know you verbally gave me a bio, but I think it's best for you to talk about you than I can talk about you. So make sense? And then after you're done talking, we're going to do some Mythbusters. So that's when Kareem and Cassandra, Linda, y'all come in with your questions and answers or your myths or why or why not you're going to get this vaccine. Then that'll be it. Okay? Everybody got it?
Yep.
All right.
So
One more minute, Dave. At 4:10, we'll kick it off.
All right, no problem. Another minute? All right.
Yeah. Another minute. I like your background there. It's kind of shiny.
Man, I couldn't put up the picture. I was trying to do the picture.
Well, I know what the problem is, but I got you, bro. I got you.
Yeah, I got to get y'all a ring light for the podcast.
Yeah, I got one. Well, it's at the barbershop. It's at the shop.
Okay.
You like that's not going to help me here, right?
No. I like the background though.
Yeah, that's gonna be our office. That's gonna be set up soon. So yeah.
Got a little time. I can pull up my textbook.
Take your time, man. We got one more minute, and Dr. Smith gonna get on and talk about this app because it's a lifestyle app and it involves all of this stuff that we've all been doing. So I'm gonna let him tell it. I'm gonna tell his thing. Go ahead, man. Kick it off.
All right, no problem. So welcome to Uepik Podcast, where everything is here. I'm David and my partner, Mr. Hood, 30 years in business. So Uepik is a scheduling app where it connects you with your hair care professional, where you can book your appointments and pay within the app. So we're going a cashless way. So it's all about everything is paid online. So on the back end for the hair care professional, we have some resources we're trying to do. We're trying to create a community in which where they can network and so forth. I don't want to give too much details of the things we have for them because it's not rolled out yet, but the app's coming out now. So another 2 more weeks, the beta. We're in the beta stages right now, which is exciting, right? So the idea came from maybe about a year and a half ago, 2019, November. Will had a side and I had a part, and we just kept meeting once a week, and we finally seen the vision, right? The idea come to fruition. And so Uepik is free to use. And so if you're a doctor or you're a traveling professional and you go to a city, you go open up the app, look for a barber, nail salon tech in that area, book your appointment. And if you need a ride, Uber gave us permission, so you can Uber ride to your hair care professional. So we're trying to make it a lot convenient, safe, smooth, and professional. And so it's pretty great idea. It's coming to fruition, and we got a lot of stuff we're going to be rolling out with the app as the app goes on. We'll add some features and so forth where we're just trying to build a community. And we just started from nothing really, and we just working our way up. So
yeah. We're going to base our success on serving the hair care professional. We believe our success level is going to be the same as the much services we give. So that's what drives us. Me being in the industry for so long, I know the ups and the downs, the ins and the outs. So now it's time to box that and give it back. So that's basically what we're about. The podcast is actually about a platform that the hairstylists, the barbers can actually be a part of and express how they feel. And so you'll be networked up throughout the nation, talking to other barbers and hairstylists. And so since the hot topic now is about the COVID vaccine, we're going to talk about it. And we have a doctor here that can actually, what's the word, Tracy? That can actually validate the facts, right? You can validate the facts. Okay. I think David's screen is frozen. Okay, he's gone. All right, so I'm on by myself. All right, Mr. Terry, go ahead and introduce yourself.
Okay.
You got the floor, brother.
All right, so my name is Dr. Treyc Terry. I'm originally from Alexandria, Louisiana. I graduated from Peabody Magnet High School in 2011. From there, I received the academic scholarship to attend Xavier University of Louisiana. I majored in biology, pre-med, which is a minor in chemistry. There I was involved in many things within the pre-med department, dealing with freshman orientation, became a member of Alpha Phi Alpha. I graduated in 2015 with honors, and I went on to University of Rochester School of Medicine and Dentistry. And I recently graduated this past year, the class of 2020. And upon graduation, I started residency at the University of Rochester Strong Memorial Hospital in pathology, clinical pathology, and with hopes to finish that in 2023 and go on to complete a fellowship in blood bank and transfusion medicine. So
wow.
That's my bio in a nutshell.
That's extraordinary. Hey, explain what pathology, explain your job, what you do.
Yeah, so pathology has two components. It has clinical components, it has anatomic components. So with clinical pathology, that's dealing with labs. Anytime you go to a physician and you receive a lab, it can be a pathologist that is looking at that lab for pathology. The definition of pathology is pretty much disease and how it forms and how it manifests, whether through these labs or anatomic. If you have a cancer, a biopsy, that's not my area, but that's the other section of pathology. So I deal with clinical pathology. So anything dealing with the blood, whether it's anemias, whether it's certain disease processes, too much protein in the blood, whether there's problems with the chemistry in the labs, or you have problems with blood clotting, that will be sent to me, and I'm able to evaluate that and update e-record or talk to the provider to see my interpretation. And so that can help them in their clinical interpretation, their diagnoses, that eventually leads to your treatment. So, wow. So no direct patient contact, but very heavily involved.
Very heavily. Wow, very important. Very important. Now, let's get on the topic straight ahead. Why should somebody be vaccinated, doctor?
Okay. I have some stuff set up. Before we get to the vaccination, I want everybody to be on the same page of what COVID is, some of its complications, some of the tests. So if you don't mind, I have a textbook that actually includes COVID that medical students are studying for their boards. And I'm also studying for my board, so this is my reference. So if you don't mind, I just wanted to pull that up real quick just to give a quick overview of what COVID is.
Do your thing, man.
Okay.
Do your thing,
all
brother.
Right. All right. Okay. Well, okay. That my computer shut off. But pretty much you have COVID-19. You can get different symptoms from it, different respiratory symptoms. People who have different comorbidities, such as diabetes, hypertension, already underlying pulmonary disease can be more susceptible. It is diagnosed by antibody tests, and they have certain treatments that they've tried. You can recover. However, due to those comorbidities, it can lead to death. So I think that's a good general overview. I'm going to see if I could pull up my textbook one last time for you guys. All right. I don't know if that's coming in clear. I don't think it is. Okay, but we get the general. It's been in the news for this past
I can read it.
Past year and a half. You know, a lot of people have unfortunately passed away due to COVID. I want to say maybe over 500,000 for the United States alone. I don't know the exact number worldwide. So yeah, so let's get into the myths. And I would like to say too, these are my professional opinions. So I just want to say that moving forward. And other doctors may think differently, or other physicians may think differently. All right.
All right. So anybody has any type of myth they want to dispel today, or they have questions about why or why not to get the vaccine?
I have a question. This past week, Dr. Fauci was saying you can still get COVID after you get the vaccine.
Mm-hmm.
But then the CDC says on the website, it was talking about that once you get the vaccine, you can't get COVID. So who's right?
I'm sorry, could you say that again?
Okay, so Dr. Fauci, right? I'm saying the name right? Fauci? That's
Fauci,
right.
yeah.
Fauci, yep. So he was at the Senate this week, and he was saying that if you get the vaccine, you can still get COVID, right? But the CDC website said that once you get the vaccine, you can't get COVID anymore. So who's right? Who's wrong?
So I haven't heard that from the CDC. My line of thoughts would be with Dr. Fauci. Just going on what we know about the immune system and science, you know,
right.
The vaccine, we're trying to get a head start on your immune system to fight COVID, right? So if we can, using the science we know with vaccines, if we can have your body understand what it may be up against if it comes in contact with this virus, it will know how to fight it. So that's my understanding. As far as it being fully eradicated, if that was true, people who have the vaccine wouldn't have any masks to wear, because that would mean they can't get COVID and that they can't transmit it, and that's not true. That's not true. That's not true. So, you know, the idea of a vaccine is that, you know, it's pretty much just like your armor. So if COVID comes, you know what you're dealing with, instead of not having a vaccine and it attacks your body, and before your body even gets a chance to learn to fight it off, it unfortunately may cause death.
Wow. I got a question. I got a question for you. How long does the protection from a COVID-19 vaccine last?
So that I don't think we know yet, but as we discussed earlier, my idea with COVID and just how it's attacked the world, I would tell people expect this to be just like the flu. This is not something that you're going to get one vaccine and I'm fine. No, it's going to be able to mutate. And as they release for this Pfizer, the one I actually received, you know, they're anticipating that this is going to be an every 12-month vaccine.
Yeah, I heard about that.
And yeah, like a flu shot. So that's my thoughts. You know, like we don't know, but I would not be surprised if it follows that same course.
So
as something you get, and you can expect to get that during a certain season once we're able to figure out more every 12 months, and you're going to be covered.
So what I read this morning, it was more or less like you get the first shot, the second shot, then every 6 months you get a booster shot, and every year you get it over again. Is that about on par?
I saw every 12 months. I didn't see like about the booster. 6 months. I didn't see that. I saw every 12 months. But again, all this is new information. But just knowing the flu and what we do already, I would not be surprised if there's another shot annually.
Okay.
During a particular season, which we've determined this is the COVID season.
Okay.
So.
What about this question? This was one of my questions. If I already had COVID-19 and recovered, do I still need to get vaccinated with COVID-19 vaccine?
Before Kareem had put, the 6-month number is based on the original trial studies. The vaccine can protect you at least 6 months.
There you go.
For at least 6 months. Okay, that's.
Thanks, Kareem.
Thanks.
Let's see.
What was your question, Will?
My question was, if I already had COVID, right? Do I still need to get vaccinated?
Yes. Yes. And so it's similar to the situation we were talking about earlier, right? So if you get COVID and you recovered, we can assume that you have antibodies, but when you're dealing with medicine, when you're dealing with sciences, we deal in probability. It's probable that you have the antibodies for COVID and you recovered, but it's an even higher probability if you receive this vaccine and form the antibodies. So I think that should be the line of thinking. Do you want to chance it that you could still get COVID, even though you had an infection, or do you want to have a vaccine and you could still get COVID? But so it's where do you want to land in this?
Okay. Let's see. Ask you another question. If I have underlying conditions, which are, you can explain those, can I get a COVID-19 vaccine?
Yes, you can. Recently, they started vaccinating patients that are inpatient in the hospital. So, I mean, that they're in the hospital for one condition or another. So
what would be like some of the conditions, though,
that
like pre-existing that would kind of be a high risk?
So if you have any type of chronic obstructive pulmonary disease, because COVID can lead to respiratory failure. So you can imagine that would be easier for the virus to cause if you already have underlying lung disease. It also can make you hypercoagulable, which means it can make you more susceptible to clots. So if you already have a genetic disorder that predisposes you to clotting normally, that can exacerbate that. So I think those are a couple things. And then you have the regular, the hypertension, the diabetes, which makes fighting off infections in general harder if you have these underlying comorbidities. So, it's a lot of factors in the one.
Okay. I got one more. I'm gonna let everybody else talk, right? I already got my shots, bro, right? Can I go around other people that have their shots without a mask? Is that safe to do or no?
Again, when you're thinking of probability and chance, you can based on the science, but should you? No, because you don't know who has been exposed to COVID. Again, the vaccine is not going to fully affect you to COVID. So why put yourself in this potential line of fire to you be safe, but possibly expose your other family members who haven't had a vaccine? Okay. It's I wouldn't advise that.
Okay. Well, I told a falsehood because I'm gonna ask you one more question, right? My question is this: if a woman is pregnant, no, let's scratch that. This is my
freestyle
question. Freestyle, right? We kind of keep it relaxed here, so nothing stiff.
Okay.
My question is, okay, I'm gonna use that question. Say, for instance, a woman is pregnant. Can she or should she get vaccinated?
To be honest, that is a tough question. My first mind wants to say yeah, but definitely with this recent events with the Johnson & Johnson vaccine with some cases of clotting, I think that would be a decision, that she would be able to make with her OB. Okay. I'm not confident to speak on that because when you bring pregnancy into the mix, it changes everything, and I would say before that, before the pregnancy and everything, get vaccinated. But as far as
you're pregnant?
Yeah, because now timing is different, and you have trimesters, and I'm not knowledgeable on what that shifts up or what that shifts down.
So, is there ever a time you shouldn't be vaccinated? Is there ever a circumstance where a person should just not be vaccinated, other than they already have the vaccine? Like is there any type of medical condition that will say prevent somebody from saying, a doctor will say, no, just don't take it right now?
Kareem just mentioned severe allergic reactions. So I would say that's definitely an indication.
Okay.
I've been on some conferences with hematology where, somebody had underlying blood conditions that make their blood more hypercoagulable, or certain cell lines are dropping, and, they work with the physician, they got the first dose. They saw some changes in the labs and they were advised not to get the second dose.
Okay.
So I think that's definitely on a case-by-case basis. And similar to what Kareem said, if you get an allergic reaction with the first dose, I'm pretty sure a physician wouldn't be comfortable giving, we're not trying to risk allergic reaction that can lead to death for trying to get a vaccine, because again, we're going off a risk stratification. That doesn't make sense, in that particular case.
Okay.
Based on this new information we have, so.
I got a question for you. So I got two for you.
Tag in Kareem, dang. It's okay.
All right, so one is, let's say now they have different variants, right? Because isn't there one like in Europe, a different variant, a different strain?
Yeah.
So does the vaccine now, does that cover those strains that will pop up?
I would say no, because in making these vaccines, we were working what we had, and when things start to mutate, that's a whole different version. That's a whole different, like I say, it's similar to the flu. Yeah, we covered the flu, but it's some years, which I can remember, where, hey, this is a new strand. This is this is hitting different than this influenza version that we were covering for. So I would say no, just based off the timing of it. But as far as how that would change what we're doing now, I'm not for sure.
Another question. So you know how it takes for vaccines to hit the market, like to the public, it takes some time, right? Like that's trials, years of trials. But how is it that this vaccine of COVID is rolled out in so fast? Not all these extra, usually years and years of preparation and testing.
So that's interesting. I actually was prepared for that because I actually did my own research. So what was done last year, the big companies that normally work on their own trials, like, hey, you working over here? Because I mean, let's be honest, you found this vaccine, this is $1 billion, and people who do research, you want to be that one. Well, what happened last year, they combined and they started working together. And that's what contributed to this vaccine being created.
So who's working together?
I can't think of the particular companies, but I'm sorry.
But so they work together?
Yeah, they started to share data.
So, all right, was Johnson & Johnson part of that data? Because what's going on with their, what's wrong with their stuff?
I'm not for sure about that. I'm not for sure. But they have a total different mechanism of theirs. I believe they were rolling out one dose vaccines, and that's not Moderna and Pfizer are both 2 shots. I received a shot one day, and 2 weeks later I got another one. And to my knowledge, and somebody can make me if I'm wrong, but Johnson & Johnson was trying to do a one shot. So you just go get it once.
So you said they was working together, but how does that working together makes it be able to roll out something so fast? That would be the question, right? Because you're combining your resources.
You know, it's synergy. You know, you get stuff done quicker when you work as a team.
Sorry, can I step in real quick? I just had a quick comment real quick. I agree with Tracy and a lot of the things that he said. One of the things that the reasons why the drug was made relatively quickly. So how these things are normally set up is that we have different phases of these trials.
Okay.
So you have a phase 1 trial, you have a phase 2 trial, and you have a phase 3 trial.
Okay.
And what ends up happening is that each of these trials ends up being done, and as soon as the trial gets done, and every trial is after it gets done, they go to the next phase. So testing it even more and more and more.
Okay.
What they did, and this is how it normally gets done, but what they did was they did all these 3 trials at once. So you do a trial where you test if the drug is bad for you and what dose it takes for it to cause bad symptoms. And then the next trial would be how much do you need to give in order to see if the drug is working. And then the final trial is to see if it works better than a placebo, which is a drug that they don't really give you anything, but it just looks like a pill, and see if it actually works. So what they did was, instead of, to save time, they did all these trials at the same time.
Okay.
And by doing it at the same time, they were able to see all the results at once instead of waiting one after another. Because it's an emergency situation, they were like, well, we don't want to just wait a year and 2 years so that everything gets done one after another. We want to do it all at the same time. And if we get bad results from any of these, we're going to stop the trial and we're going to stop testing the drug. And what they did, instead of waiting one after another, they just did all the trials at the same time, and they saw that the drug was safe in that time frame. And that's the biggest reason why this drug came out faster than all the other ones. That doesn't necessarily mean that it's not safe. It just means that the process was done differently. Instead of taking that one step, then the second step, then the third step, we just did step 1, step 2, and step 3 all at the same time. And that's how it works.
Yeah. And which with that knowledge, you know, you have access to more data, more people working towards the same goal. You can see how that could expedite this process. Which phase 4 of all of this is actually getting these treatments to the patients, the people who need it, and monitoring to see if there's any adverse effects. And, you know, it's just time. That's the only thing you can't really speed up, to see what's going to happen once we finally release these products to the public. And then thanks for that, Kareem.
Yeah, and then the other thing that I wanted to just say, in that with respect to pregnant women, the Society of OBGYN, which is the Society of Obstetrics and Gynecology, has made a recommendation that they recommend that pregnant women still get the vaccine. Now, the reason why there's so much controversy surrounding pregnant women to get the vaccine is because of the fact the original trials did not have specific testing on pregnant women. However, it uses the exact technology that some of the other vaccines have used. So the influenza vaccine uses very similar technology to the COVID vaccine. And we still recommend that pregnant women still get the flu vaccine. And so, while the studies don't particularly assess women specifically that are pregnant, they do use very similar technologies, which is why the this society has recommended that women get the vaccine. And they also say that the reason why they're saying this is because the risk of getting COVID are worse than the risk of taking the vaccine. What's always lost in these conversations, I feel like, with respect to side effects of the COVID vaccine, is that when you get the COVID vaccine, there are some side effects, but some of these side effects are side effects that you would also get, probably to a greater degree, probably worse, if you actually got COVID. And so that's something that tends to be lost. Now, coming back to that idea of pregnant women getting the vaccine, What the society has said is that they recommend that people get the vaccine, but they understand that because there isn't specific trials, that, like Tracy said, this should be a decision that is made both with the obstetric gynecologist physician and the patient, and it should be their own personal decision. But they do make that recommendation that they should get the vaccine.
Okay.
Thank you, man. Thank
That's
you.
good.
Thank you for that.
Cool.
Thanks a lot, Kareem. Dr. Tracy. Okay. I think I have a Mythbuster for you. I think I have a good one. I'm not taking that vaccine because I don't know what's in it. How about that one?
Do you always know what's in your vaccines?
Yeah, I look them up. I ask questions.
Okay, so when you were born and you got all these vaccines, you knew exactly what was in it.
Well, you know, that wasn't my responsibility at that time, but I'm a responsible adult now. I care about what goes in my body, you know?
I mean,
Do we
yeah,
know?
you can look it up, but it doesn't change what it does. The technology, it doesn't change its effect on your body.
Okay, so we don't know. So we skip that question. How about
No, I mean, you can find the exact components. I'm just saying, for me,
for you?
this
Okay.
is my training, right? This is what they tell us in med school.
All right.
Medicine is like picking your nose. You better know what to do if you find something. So it just
I never heard that before, man. You just made that up.
No, this is what they tell us. You go looking for something. You better know what to do if you find it.
You better figure it out.
Somebody would have to have some component that, I don't know, maybe it's against their religion, that is in this vaccine that's just gonna be like, that's it. No, this is where I draw the line. And I don't think that's the case.
All right, I got you. Now,
Mr. Hood.
yes.
So one quick thing. I think it's important to kind of explain just a little summary of how the vaccine works. So basically, COVID has what's called the spike protein. It's a little protein that's on top of the virus that we have created, and this little protein doesn't necessarily cause the effects of COVID. It's just a little protein. It's almost like being able to identify somebody because they're wearing a hat. You don't always get them right, but like if you know that this person's the one that's wearing that hat all the time, that's how you're going to get it. And so the idea here is that because of the fact that we know that COVID tends to show this protein, the vaccine works by tricking the body into making this protein inside itself without causing the actual COVID symptoms. So the idea here is that if we can trick the body into basically being like, hey, COVID's here because this spike protein is here, I want you guys to create an alert. I want you guys to create an alert in the body. And so what the vaccine does is it creates this protein. Your body, the immune cells come in and they're just like, oh, something bad is here. Let's make sure let's recognize this and let's make more of us to protect us from this bad thing that just showed up.
Okay.
And then once we expose the body to the spike protein, more of these immune cells, our protector cells, our white blood cells, they increase in number and they recognize this. So that way, when the real COVID comes in and it shows the spike protein that I keep mentioning, the body recognizes it immediately and goes off and kills it or covers it up so it doesn't affect our body.
Mm.
And a lot of these vaccines kind of work in very similar ways, but that's the basic idea. You're not really putting, in a sense, the real virus into your body. What you're doing is just making something that the virus makes just by displaying itself the same way that, you have, color eyes that are brown. The virus has this protein and it basically serves as a way for the body to recognize it. And that's all we're doing. And we figured out a way to basically trick the body into recognizing this and then creating cells that protect them.
Okay.
And as you can see here, I have a picture of this spike protein
Okay.
from the latest books that we're studying from our boards. And based on the science that Kareem, was able to discuss, this is why people are having quote unquote side effects that they're calling side effects from this vaccine. It's really just your immune system learning. So that's why we have been telling people, when you do experience maybe a little fatigue or myalgia, don't take ibuprofen, don't take acetaminophen, don't try to help your immune system when it's trying to take this spike protein and get ready for the real COVID if it comes in contact with it, so ride it out. And like Kareem said, just think of some of these side effects or some of this fatigue or whatever being maybe 1/10 of what the real COVID could feel like, and with its symptoms. So even me personally, the first dose, I had fatigue. I didn't take any medication. I wrote it out, and it was gone within 24 hours. So, and I was fine with the second dose. So, just to put into context some of the things people may be experiencing with their first or second dose.
So this vaccine is 100% safe. Anybody?
So I think the thing is, by saying the problem with using things like 100%, and doctors hate talking about percentages. The reason why we hate talking about percentages is that when people hear percentages, they're very irrational. So you wake up every day and you take the car to work. There's a risk when you take the car to work that you can get into an accident. There's a risk when you take Tylenol that something bad could happen to your body. And so when you ask people, doctors hate coming over to a patient and the patient goes like, is this 100% safe? Nothing's 100% safe. I think the real question is this safe enough that the average person wouldn't suffer any major consequences? And I think that's the key here. I think the key here is to remember that in terms of what we know and what's based upon the studies. Now, keep in mind, we do have a year of studies, and the majority of bad symptoms happen within a year that we know of for the past vaccines that we have all taken. That's when the majority of really bad stuff that people worry about. So in that case, there have been side effects that we're really worried about. Now, I know that a lot of people are going to bring about this idea of the Johnson & Johnson vaccine. And hey, like, you guys said this was safe, this was put on the market, and then now we see these side effects. Now, I think the most important part to learn, just like Tracy mentioned earlier, there is what's called a phase 4 trial. Phase 4 trial means that it's been seen as safe for 3 phases of trials. And it's safe enough that doctors feel comfortable giving it to their patients and scientists feel comfortable that it's given to patients in an outpatient setting. And they continue monitoring because of the fact that sometimes in all these trials, there is a minor small set of the population who could have really bad side effects that aren't necessarily tested. It doesn't mean that it's not safe. It just means that we're still learning that there are some people who the vaccine might have had a bad side effect because of something that they have, or because they're more likely to have a bad side effect from getting COVID in general. It's not necessarily because of the vaccine. It's because, yeah, you took the vaccine, but the problem is that if you would have gotten COVID, you probably would have gotten this symptom or something worse. And so what we're trying to do is get ahead of it and find out, hey, this specific group of people is having bad symptoms from the vaccine. And that's all that's happening. It's not that we're coming in and basically sending this vaccine out and saying, hey, this vaccine could be safe, we're still not sure. No, it's for a large proportion of the population. And when we talk about this stuff, we're talking about people where this is like 6 people out of, a million doses that have been given out. There are things that you do in your everyday life that are more dangerous than the Johnson & Johnson vaccine. Like getting into a car, that is more dangerous for you than taking the Johnson & Johnson vaccine. But we're scared because we don't want to get sick. But the thing is that anytime we take this stuff, there's a risk. The problem is we just need to figure out why these people are having this, not that all these drugs are not safe.
Okay, so in general knowledge, or general practice, it's pretty much safe. Not 100%, but generally speaking.
Yes.
I think you may have convinced me to get this vaccine. I'm not sure. I'm not quite sure yet. How about Miss Davis, Patricia, Miss Patricia, Cassandra, and Jackie? You have anything you want to say? I don't. Oh, Miss
I'm
Davis.
here.
All right. Any questions for the doctors?
No, I think they answered any question that I may have had.
Okay.
But very good, very informative. Appreciate it.
All right. Anything you want to add to it?
No.
Okay.
I think that we just need to do more of this. I noticed that you actually just went live on Facebook because I wanted to share it. And I think the more opportunity we have to do these type things, try to reach as large of audience as we can. I think it's so important.
That's so true. Me and Kareem was talking today in the barbershop about, he was asking, do you think there's education or something lacking that is preventing us as African Americans in getting this vaccine? And I told him I think it's a little bit of both.
And so it's about to get dark. It's the perfect segue into the second part of this talk.
All right.
Especially for my community. As much of comorbidities, diabetes, hypertension, obesity, when did everybody become so concerned about their health? And I say this to add that based on we haven't put enough stock in health in our community to really even have a choice with this vaccine. Because you know why? If worst case scenario, if Blacks fall behind and not getting this vaccine, everybody else gets it around us, and we start being the ones with the highest COVID emissions, the ones dying the most, we're gonna say it was racism. When that's not the case. And this has been evidenced because even in New York City, I believe it was in a poor Latin community, they were giving out free vaccines. Who was coming from the suburbans taking all of them before they even knew they could have got them? So I think we have to realize where we're up against, because if COVID does run rampant and continue to run rampant in our community by not getting vaccines, we don't have the resources, we don't have the best hospitals to fight this thing alone. So I think that's one thing I've been wanting to have a platform to kind of,
right.
Maybe I can get your, everybody else's thoughts, about just this vaccine. And we haven't been making the right steps as a community to even really have a choice. If you ask me, I just feel like it's in our best interest, just with our diabetes rates, our hypertension rates, certain socioeconomic situations. We don't want to set ourselves up for a perfect storm for this virus to run rampant.
Right.
So, and that's where I stand on it.
Miss Jackie, what you got to say?
So, good evening, everyone. I agree with Dr. Trey to a certain extent, but we also have to think about, as a people, one of the reasons that I think that our folks are, I don't like to say the word, I don't like to use the word hesitant, but, we have some hesitancy, we have some outright no, we have some folks who are on the fence. And so for me, it's really about us knowing what science looks like. What, when we think about, we have a history, a bad history, if you will. And so, when COVID first came around and, people were saying that, of course, we're disproportionately impacted by it because of our, our health disparities. And, outright people are saying no, including myself. Nope, I'm not taking that because of Tuskegee, because of Henrietta Lacks. There's some history there. But we also have to move beyond that as a people, and like Dr. Trey is saying, You know, we are disproportionately impacted by high blood pressure, diabetes. You know, and so we have to begin to think beyond. You know, rightfully so that we feel this way, but we have to move beyond that. We have to move beyond the history, because out of that bad history also came some good history, and we don't think about, you know, before we go to school we have to get vaccinated, and we're supposed to get vaccinated.
And also,
so we've been going through. Go ahead.
I didn't mean to cut you off. But
No,
also too, we now have young African Americans who are in medicine based on all these historical things that inspired them to go into medicine to make these change. So if you have African American that's in medicine and they're recommending you those things, I would hope you would think they have my best interest in heart. I didn't join medicine to make my community worse or to put them in more harm's way. I joined medicine to be an advocate for my community, to make sure that these things don't happen again. And there's plenty of Black doctors in medicine, surgery, OB. And so when we are saying these things, just know it's coming from a good place, and we're leading by example. We're getting the vaccines ourselves. So we're not telling you nothing that we're not doing.
So, Dr. Trey, if I must say, I commend you for what you just said. There are Black doctors, right? There are Black medical providers, but we don't see enough of them. We, even in this season of COVID, you know, Dr. Corbett, who actually participated, you know, and was one of the leading researchers, you know, for COVID, around COVID, the vaccine, in the lab doing the work, you know, so this is unique to us when you talk about Black physicians, because we, as you know, in our community, a lot of our Black physicians are not in our community, right? And so this year and this season of COVID is really the first time that that our Black medical providers are being noticed, because they are stepping up and saying, hey, you know, this vaccine is safe. You know, we have a Black researcher here in Rochester, the only Black female researcher here in Rochester. And she's been out in the community and having conversations. Because for us, we want to see people who look like her, right? You know, educating us. And
yeah, and I think we may have lost her. But to say that, do we really champion people in our community that are going in? Like, do we really revere these people and want to put them in the spotlight and want to hear what they got to say? You know, I mean, that's a question we can answer. I mean, I appreciate Dr. Hood, you know, inviting me on this platform, but what are the odds, you know, that I would get asked that? I should be on a Zoom like this every weekend. You know,
that's
how many
right.
Black people, you know that we've had 3 African-American Surgeon Generals. During COVID, probably was a lot of people's first time knowing Jerome Adams was a Surgeon General. So it's a lot of disconnect, and you know, so.
But again, it goes back to education, right? But it all goes back to education, right? And so the more, Linda just said, the more that we're having these conversations, because it's really about building rapport and relationship. Because for us as a people, relationships is our highest value. And so when we're having these kinds of intimate conversations, people listen, because we want people, we're not saying, you know, everybody's not going to take the vaccine. But
they didn't hack us. They know it's some heat. The government, they hacked us. They know what they doing over there. They trying to better their community.
Yeah, she has a bad internet connection, it sounds like.
Yeah. So I guess I'm
you hear me?
You keep breaking up, Miss Jackie.
Okay, I'm sorry. Yeah, so we want people to make sure that they are educated enough to be able to make, to give an articulate answer to, whether it's no, I'm not taking the vaccine, or yes, I'm taking the vaccine. And really, again, it's really about educating people. And some people are not going to take it.
But what I don't understand, I can say some people are skeptical, but Joe Blow on Facebook puts up a meme, and that's the fact that the person is gonna run and share. That's what I think what struck me the most is that I'm getting so many questions from my friends and family, but somebody can post, "Oh, COVID is from 5G cell phone tower," and that travels faster than my post.
You're absolutely right. Those conspiracy theories. You're absolutely right about that. But again, being able to have platforms like this on a consistent basis, because we have to keep things in people's faces, right? Like these conversations should not be a warning. Like they should be consistent, and people having this conversation and inviting, other people to join in. Everybody on this call should be doing the same thing, whether it's with family, whether it's with your friend, whether it's with your guy friend, because we're all actually having these conversations already.
Mm-hmm.
It's just automatic because it's
yeah. You were saying something, Kareem?
I just wanted to get thoughts on what do you think is the biggest, I don't want to say it's an issue, but what do you think is the biggest thing that people in the Black community who are pushing for the vaccine, because, we're looking at people in white communities who there is a contingent of people who don't want to take the vaccine, but there's a large contingent who do take the vaccine. And I guess I'm wondering what do you see as like the biggest limitation in terms of how people are viewing the vaccine? Is it more that they have, an idea about, and I know the Tuskegee trials have been mentioned with respect to syphilis in the past and these types of vaccine issues, or do you think it's more of a lack of education, or do you think it is more of a fear of these types of
what
things?
I've seen, Kareem, I don't think it's a lack of education, but to some people, depending on, just being fortunate, being blessed, COVID is still an abstract idea. They don't know anybody that got COVID. They didn't have COVID themselves. So it's real, but it just hasn't became real within their lives. And I speak to that even when getting the vaccine. I have to look at my bias. Every day I go to work, I'm reading, patient records has COVID, on life-saving measures or palliative care. So it makes my decision more readily. But if I'm somewhere, in a community that I don't know anybody that has it, I could see there would be less urgency to want to get this vaccine.
And I'm gonna push back on that, Dr. Trey, and say I do believe it is lack of education. Because and one, I'm most of us are involved in the day-to-day projects of what's going on with the vaccine. I actually was in one of the trials, and so I was saying earlier. COVID is similar to HIV when HIV came out, right? Like it was something that people didn't understand, that people didn't, couldn't grasp. And, it was like, if it's not affecting me, then, like you just said, Dr. Trey, then I don't need to get involved. I don't need to take the vaccine. But it's really about people being educated and knowing, because most of the time it's a little bit of everything. But I think education mainly, because you hear it was made too fast, right? The reason you hear that because people don't realize that COVID is a part of SARS. SARS has been around since over 20 years. The fact of what's happening is because of technology now and how things can be done at a expedient rate. Right. They've been able to, you know what I mean? So it's been around for years, and so again, if people don't know that and are not educated around that, then for me, it's really the education. It really is. It's really about, because for me,
no,
it's like, go ahead.
I think it's definitely education. I think that's we say that a lot, and I was just trying to give maybe another factor that goes along with the education. But I definitely agree. It definitely is a lack of education that's contributed. But you gotta want to be educated.
Do you feel like a lot of these recent attempts by different groups, including people like in basketball, that have tried to get certain celebrities and people that are seen well in the Black community that are taking kind of the vaccine? Do you think that that's making an impact on people's decisions, or do you think that is not really working?
I don't, for the similar reasons, which I feel like I would get more pushback, because what I had to unfortunately come to the conclusion, when you have a certain position or a certain role in society, if people deem that you're part of the system, you're going to catch some of that mistrust, whether you're Black, whether you're from their community, because people are going to question, what are your intentions? You're just telling me get this vaccine just to fill your pockets. So I think it's good, but I think the actual community leaders, I think that would have more impact than LeBron James just going to get a vaccine.
Thank you.
I agree.
So if my barber gets the vaccine, I'm like, just saying, just an example.
Well, I think I was on the fence with the whole thing, as you know, right? And the more that I talk to you and I talk to my comrades and everybody, I think I'm going to go get my vaccine. I think we'll get it. So this is very, very, the education is everything. So it really helped me to decide, because I had a lot of questions in my head. Mm-hmm. And a lot of those things were myths. So like on our podcast, we do Mythbusters, no matter what the topic is. So we always have an expert like yourself to bust those myths, and hopefully somebody can come on over to the truth. So we thank you for that. I'm sorry.
Yeah, and I think what gets lost, physicians love that people are wanting to learn and wanting to do their own research, because we're hoping that this can apply to other medicines you take. Like when a patient really takes on their health and their own journey and wants to be more knowledgeable and get the correct information, that makes our job easier. Because it's really showing ownership that I want to know what I'm putting in my body. I want to know how it works. I feel like that just makes a better physician-patient relationship. And like I was talking to Mr. Hood, I don't believe in a physician being a helicopter. You take this for hypertension. No, I believe in the coach model. I'm your coach, you're the player. I want to see you improve. You want to see yourself improve, and we can meet somewhere in the middle, So that's just my philosophy dealing with medicine. I don't think it should just be, take this just because I told you so. No, I don't think that's right.
All right. Well, to sum up everything, in a sense, not really use the word sum, but where can a person get a vaccine, or how do they qualify for it? If anybody has any kind of information, you can put on the screen, or Doctor, you can talk about that. Kareem, you can talk about it. Miss.
I go to church with the mayor, and this last Sunday, she did say there's key spots in Rochester where you can get the vaccine. Yeah, Mayor Lovely Warren, yeah. They have key spots within the city. I wish I had this information with me, where if you want the vaccine, you can go and get it. That would have been great to present today, but that information was relayed to me.
And I do have that information. I actually was
Okay.
working at one of the equity pods this morning. So this morning, we were at the Jackson Recreation Center. So we actually did 2 pods this morning. We did a pod for the deaf and hard of hearing folks in the community, and then it was opened up for everyone. So they also did walk-ins today. So they're starting to do walk-ins for folks. This week was the second week that they were at a few of the churches in the city, Baber. If you go to the www.monroecounty.gov website, it shows, it gives you a list of all the places that are actually providing vaccinations. The Dome Arena, the Rochester Convention Center. We also heard today that Hawkeye has opened back up. So what they're doing is opening up what they're calling equity pods within the communities. So they're utilizing the churches and the rec centers. I think next week they're going to be at Webster Avenue School, the Ryan Center. So if you go to the website, all of those sites are listed.
And just before we go, because I want to be, partial with all this information, there was a recent article saying we are seeing a slight increase in COVID cases. And Mr. Hood, could you wonder why that is? People getting the vaccine and just, feel like everything's back to normal. So I understand people are getting restless and it's summer, people are going to clubs and people are restless, people are not wearing their masks. So I think that just kind of rounds out the conversation that, yeah, we made some progress, but we still have a way to go. And even with this vaccine, you should still be conducting yourself in a certain way to protect yourself and others. So.
That's right. All hearts and minds are clear. Anybody got anything else they want to say?
Nope.
All right. I think everybody. Nope. Everybody's good. Well, thanks everybody for showing up, and we're gonna be here every week.
Yeah.
Our next podcast is going to be on the violence in Rochester or in the nation, and the correlation with that with poverty. So we're going to hit different topics. We're going to come back to this one because it's going to be a weekly one until we get where we need to get. And Dr. Terry, I appreciate you so much, man, for taking the time
man.
out. I know you're a busy man. You're a busy man.
Yeah, back to studying. This is what we do. We lifelong learning.
Yeah.
Study break. This is a good study break.
Kareem, I thank you for jumping on the last minute. We appreciate you.
Thank you. Awesome questions and all answers.
So, Dr. Terry, you want to put in the chat room how they can contact you if they have further questions?
Okay. I can put my email, my personal email. I'm pretty good with responding. I check my email probably 50 times a day. It's a problem, but hey, you got to stay on top of things.
Right.
So this is my email.
I see
and again, I'm all about educating. I'm definitely passionate about my community. I work closely with the Black Physicians Network, which is a resource that a lot of cities don't have, which is here in Rochester. It was established in 2015. So, and I could definitely get you in contact if you're looking for somebody to be a primary care provider, OB, maybe even internal medicine physician that looks like you. I can make that happen because I think that
Dr. Terry, just so you know, Dr. Clark works at Common Ground Health, so a few of us.
Okay. Oh yeah, that's we know each other very well.
Yes. So we're familiar with the Black Physicians Network. So thank you. Great job, Will, both of you.
Yeah.
Well, everybody have a blessed night. Thanks for coming to the Uepik Podcast. We love you guys. You take care.
Thank you.
Yep. Bye-bye.
Bye-bye, everybody.
Bye, guys.